failures, in spite of fact that their cardiac output is more than normal, they are labeled as patient of high output cardiac. But such patients are less common. Most of the patients who have heart failure, they are the patient belonging to low output cardiac low output cardiac failure. What really I mean by low output cardiac failure means that in these circumstances, the group of patients who have low output cardiac failure, it means peripheral demand of the body may not be exaggerated, they may be just normal, but heart is unable to maintain even the normal cardiac output. Am I clear? Let's talk about these conditions. Let's concentrate just on the left heart, which is more commonly going under failure phenomenon, right? That how there can be low output in the left heart. What could be the causes of? Yes, low output failures, right? We will again go with our very basic concept. Here I draw the, what is this? You must be knowing your friend left, ventricle. Here is, yes, what is it? Left atrium. Which valve is here? And which valve must be here? The aortic valve. Now listen. Why left ventricle like a donkey fails? What are the circumstances under which when this particular ventricle, right? And similar analogies can be applied to the right side as well. But right now we'll concentrate just on the left side for simplicity. Why this ventricle failed to provide enough cardiac output? One reason may be very simple. There is disease intrinsic in the myocardium. Yes. What we say that contractility of myocardium is reduced. Contractility of myocardium is reduced. It may be due to intrinsic problem to myocardium, or it may be due to some extrinsic factors which depress the myocardium. Again, let me tell you what has gone wrong. One reason may be due to reduced cardiac output, maybe the myocardium is not healthy, or it is healthy but some external factors suppress its performance and your myocardium is depressed. Is that right? And it is unable to perform its pump function, it is unable to perform its contractility functions. Right? For example, one of the very common reasons, what is the most common cause of left ventricular failure? Or yes, ischemic heart disease. The most common cause of heart failure is ischemic heart disease. So we can say, here we write, yes, pump failure. Pump failure, which one? Myocardial failure. Myocardial contractility failure. Failure, right? That lead to low output. Contractility failure. What could be the reason for contractility failure? Again, there may be intrinsic diseases of intrinsic problems to the myocardium, or there may be, yes, extrinsic problems. When we talk about intrinsic problems, right, classically, I'm not going to all the causes, but at least you must know the most common cause of reduced functional myocardium is ischemic heart disease. Ischemic heart disease. If large area of myocardium has gone under infarction, or multiple areas have undergone infarction, and then they are replaced by myocytes are lost. They are infarcted and they are replaced by fibrotic tissue. Do you this ventricle has enough contractility power? The answer is no. So cardiac output will be more than normal or less than normal? Less than normal. Your donkey is sick, isn't it? It cannot perform well, right? So low output failure may be due to intrinsic diseases of myocardium, problem with the myocardium or the loss of myocardium function. Either mass of myocardium is lost or health of myocardium is lost, right? It may be ischemic heart disease. Any other cause you can tell me? Yes, cardiomyopathy, but tell me something more. Okay, why don't you tell me hypertrophic and dilated heart? What are the mechanism? Is that right? Hypertrophic and dilated heart. If heart becomes dangerously dilated, right, it cannot pump well. Is that right? Now, ischemic heart disease is a classical cause as a intrinsic problem. Then he is saying, for example, myocardium is sick due to some other reason.
स्किन ग्लो के लिए जो सोप है, एक तो ये है मुल्तानी मिट्टी वाली एलो मुल्तानी मिट्टी, ये वाली मुल्तानी मिट्टी, और दूसरी है ये केसर वाली। दोनों ही स्किन ग्लो के लिए है, ठीक है। IMC एलो केसर और ये मुल्तानी मिट्टी वाली।
Myocardium cannot contract well. Or in hemochromatosis, extra hemosiderin is deposited in myocardium and it produces toxicity to myocardium. It may not work well, right? Or there may be extrinsic problems. For example, there are some drugs which are cardiotoxic, donorubicin. There are some drugs like extrinsic factors, right? They may produce damage to the myocardium. And of course, when myocardium is no more healthy, it cannot pump well, and patient go into what problem? Cardiac failure and low output cardiac failure. So low output cardiac failure may be due to reduced contractility of myocardium, and this reduced contractility may be due to intrinsic problems within the myocardium, or it may be due to some extrinsic factors which suppress the myocardial function. What suppresses myocardial function? Even acidosis. Severe acidosis suppresses myocardial contractility. Metabolic acidosis, right? So there may be intrinsic problem with the myocardium and it failed to pump well, or there may be extrinsic suppressing factor to the myocardium, which may, for example, another extrinsic toxicity of negatively inotropic agents. Negatively inotropic agents will reduce the contractility of the heart dangerously. Can you tell me some group of drugs which are negatively inotropic? Yes, please. Dr. Naeem? Dr. Tanzila? What are the drugs which are negatively inotropic and they can suppress the toxicity of those drugs, can produce heart failure by reducing the contractility capability of the myocardium? Of course, that will be low output cardiac failure. Don't tell me name of one drug. Just remember a very big group. Almost all antiarrhythmic drugs. Almost all anti-tachyarrhythmic drugs. The drugs which suppress the tachyarrhythmia in excessive doses may convert into like overdose of beta blockers, overdose of calcium channel blockers, overdose of sodium channel blockers, and so on and so forth. So just remember as a group, antiarrhythmic drugs, when they develop, you give it for toxic level, right? They may behave as negatively inotropic drugs. And those negatively inotropic action may lead to failure of contractility of myocardium. So why the failure of problem is with the contractility? Either myocardium itself is diseased or there is some external factor like, yes, I did not mention, external factor which may suppress the performance of myocardium like acidosis, like other cardiotoxic drugs or substances. What is the most common cardiotoxic substance which is taken by human beings? Yes, please. Dr. Naeem, you must be knowing that. Yes. What is the most common substance which is taken by human beings, and that is excessive doses may lead to cardiotoxicity. And in low doses, low concentration, that may be beneficial for coronary artery disease. Please tell me. Yes, she knows it rather than you. Alcohol. Yes. Alcohol can lead to, yes, damage to the myocardium, suppress the myocardial function, and that may lead to cardiac failure, right? So acidosis, cardiotoxic drugs, alcohol-induced cardiotoxicity, right? In all these conditions, contractility of myocardium is reduced. Problem is not with the afterload or with preload or with the rhythm of the heart or rate of the heart. Problem is with the intrinsic performance of the ventricle. Either ventricles themselves are sick or they are suppressed. Or both these conditions will lead to high output, low output failure. Yes, low output failure. Okay. Now we come to the second mechanism. Let's talk about some other factors like, yes, heart is a donkey. It may have performance problem, right? And then it may have preload problem. Do you remember that? I told you performance and stroke volume depends on, yes, preload. What is preload? Preload is the amount of the blood present at the end of the diastole in the ventricle and diastolic volume. So preload is the amount of the blood which is accumulated in the ventricles just before the contraction